What's going on, world? Hey, welcome. You guys already know what we're doing today. We are doing NCLEX questions today on this glorious and marvelous Wednesday. I am your host, Kevin. I also go by the Boot Nurse. You guys can check me out on all those social media platforms. So you guys already know the deal. We are not going anywhere until I get 1,000 likes and I got 100 people up in here. Play with me if you want to. All right. Hey, but I want to know one thing. Who here passed NCLEX over the last 2 days? I need for y'all to drop them down in the comments so I can give you guys all the love and all the flowers and everything that you could think of. What are we thinking? What are we thinking? What's up, Grace? Grace, don't think I didn't see you just come up in here. Don't think I ain't see you just come up in here. What's up? It's at 11:11. What's up? What's up? Aisha, thank you for the rose. We just getting started. It says, I'm just here to tell you that I'm taking my NCLEX tomorrow. All right, cool, Chloe. I appreciate you telling me that you you're took your NCLEX tomorrow, but you already know you got to go. I passed the NCLEX. Moosey, stop lying to me, bro. Stop it. Stop lying. Stop lying. All right. Did you really though? Did you really? Son of a beach. Did you? What's up, Kate? How are you? Hey, I need 1,000 likes. I need 100 people up in here. You know what I'm saying? Hey, that's what I need. Hey, we ain't going nowhere. I got some NCLEX questions over here for y'all. But if I don't got 1,000 likes and I don't got 100 people, then sorry. We ain't going nowhere. Practice quiz. Then you didn't take it, guy. What are you talking about? So, hey, if you guys are new here, welcome. Hey, I got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check them out for yourself. But hey, I need 1,000 likes. Don't be stingy. By the way, if you're in nursing school right now, what are you doing? If you're in nursing school right now and you have not shared this to your cohort in cahoots, what are you doing? So share, follow, get it out to the people that need it. All right. We only got 91 people up in here. I only got 500 likes. What we doing? Is it because I started a little late? I'm sorry. Savage Mama, you failed Hesse. I'm sorry to hear that. What's up, Ebony? I see you. What's up, Diamond? 100 what? You talking about me 100? You 100? You trying to get carpal tunnel? What we talking about? Hey, we got 100 folks up in here. Got 106. We still lacking with the likes. When are you doing cahoots? First of all, Black Beautiful. I am in cahoots with no one. And cahoots is only a nursing school thing that I just found out. So 100 likes. Hey, I need 100 right now. All right. Hey, but also I want to know who you are, where you're from, where you are at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us today? But ladies and gentlemen, you guys already know the deal. We are doing live NCLEX questions off nurseslabs.com. You guys can go over there and check those out for yourself. Tiffany, what's up? How are you? And here we go. And question number 1, during a routine checkup, nurse, Mary Ann assesses a male client with acquired immunodeficiency syndrome or AIDS for signs and symptoms of cancer. What is the most common AIDS related cancer? Is it squamous cell carcinoma, multiple myeloma, leukemia, or Kaposi's sarcoma? What are we thinking? Hey, by the way, make sure you guys keep liking, you guys keep smashing, you guys keep sharing, because that is the trifecta that gets out to the For You page. It says PharmD, but the algorithm keeps bringing me here. That's because, Anita, you want to be here. Stop playing. You know you want to be here, girl. Getting this learn on with everybody. I appreciate you being here, though. My first session in Memphis. Shout out to Memphis on Hood. No, let me stop. All right, y'all. I'm going to give y'all 10 more seconds. 10 more seconds. I got D. Okay. All right. Ladies and gentlemen, as you guys are coming in, we're doing NCLEX questions. These are both for RNs and LPNs. I get asked that question a lot. You guys can check that out over there at nurseslabs.com. Shout out to all my patient care techs, my LPNs, my occupational therapists, respiratory therapists, X-ray, who else? Labs, even though my stuff isn't hemolyzed when it goes down there. You already know the deal. So, hey, just saying, shout out to all of y'all. Somebody says, I just passed my NCLEX, but I feel like I should be studying. Is it Raiden? Raiden, you don't need to be studying. You already passed. Congratulations. Everybody give Raiden all the love and all the flowers. Congratulations. Welcome to the greatest shit show on earth known as nursing. If you have one piece of advice to give everybody, what would it be? And the answer is D. Kaposi's sarcoma is the most common cancer associated with AIDS. That is physiological adaptation, which is 11 to 17% on the NCLEX exam. Hey, remember, there's 8 section client needs, and the first top 4 make up more than half of the exam. So shout out to you, Raiden. Shout out to everybody else that got that question right. Question number 2. Ricardo is scheduled for a prostatectomy, and the anesthesiologist plans to use a spinal or subarachnoid block during surgery. In the operating room, the nurse positions the client according to the anesthesiologist's instructions. Why does the client require special positioning for this type of anesthesia? Is it to prevent confusion, seizures, cerebrospinal fluid leakage, or cardiac arrhythmias? What are we thinking? What are we thinking? So shout out to all y'all. Hey, if you are taking your NCLEX tomorrow, go away because you don't need to be here. This is cramming. You can come here, tell me, hey Kev, we're taking our exam, blah blah blah. I wish you nothing but the best. I don't need to wish you luck because you put in the work. And then come back on Friday and let us know. Come back on Friday and let us know. It says for real, go away. You don't need to stress. Yeah, you don't need to stress that I'll be bringing up in here. All right, I ain't trying to do that to y'all. Go get some sleep. Drink some water. Don't drink alcohol. Don't be a fool out there. Go home, go to sleep, relax, watch a movie, watch anime. That's what I do. You know what I'm saying? So do a little bit of that. But the answer is C, to prevent cerebral spinal fluid leakage. The client receiving a subarachnoid block requires special positioning to prevent CSF leakage and headache and to ensure proper anesthetic distribution. That's part of reduction of risk potential. Not true. I'm a CRNA. Well, CRNA, you know better because it's what NCLEX wants, not what you want. Come on, guy. Really? And it's part of reduction of risk potential, which is 9 to 15% on the NCLEX exam. Remember, this is an exam to become a basic straight out of school nurse, not a basic straight out of school CRNA. Come on, guy. We know better. So, hey, for shout out to everybody who passed? Who passed? Hold up. Is it Nick? Did Nick say that they passed? Nick, did I miss that? I took mine on Monday and I passed. Nick, that's what I'm talking about. Hey, everybody right now, give Nick all the love. I'm sorry I didn't see that, but congratulations. Welcome to the greatest shit show on earth, known as being a nurse. All right. So if you can give one a piece of advice, what advice would that be? All right, here we go. I take mine in 3 years. Hey, you got time. Hey, ain't nothing like a good time to study as in right now. All right. I'm from the Philippines. And I'm going to take my NCLEX in April here in Tennessee. Shout out to you, Dorian. Shout out to you. Here we go. Question number 3. A male client had a nephrectomy 2 days ago and is now complaining of abdominal pressure and nausea. The first, keyword, the first. What's up, Sky? The first nursing action should be what? Auscultate bowel sounds, palpate the abdomen, change the client's position, or insert a rectal tube. What are we thinking? It says, don't take things to heart. Been doing things for 7 years. 7 years. People are just mean with no reason at times. What are we talking about, Vega? What happened? What I miss? Hey, people don't come up in here and bother me because I just give them a 600. 600 just means 600 seconds, which equals 10 minutes. And that's how long I block you. And in reality, I just block you forever because I ain't got no time to deal with you. Hey, if you guys are new here, welcome. They shut off at 85 questions. Is that good? I would think so. We're doing NCLEX questions both for RNs and LPNs. Make sure you guys like, share, and follow. That is the trifecta that TikTok needs. By the way, if I don't have 10,000 likes by the time I get to question 10, trust and believe me, I will boycott the rest of these questions in recognition of Black History Month. Y'all play with me if y'all want to. All right, here we go. And the answer is A, auscultate bowel sounds. If abdominal distension is accompanied by nausea, the nurse must first auscultate bowel sounds. If bowel sounds are absent, the nurse should suspect gastric or small intestine dilation, and these findings must be reported to the physician. That is part of that is part of physiological adaptation. Who is that? What's up, Alexis? That's part of pharmacological. Oh my God, not. It's part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. Sorry, y'all, I got distracted because Kate came in here and said that she took her NCLEX yesterday. So shout out to you, or passed her NCLEX yesterday. Everybody right now, Kate Baker, give her all the love, all the support. Shout out to you, Kate, for conquering your NCLEX. If there's one piece of advice that you could give to everyone taking their exam, what would that be? Welcome to the greatest shit show on earth, known as being a nurse, whether you are an RN or an LPN. All right, here we go. Question number 4. Wilfredo, with a recent history of rectal bleeding is being prepared for a colonoscopy. How should the nurse, Patricia, position the client for this test initially? Initially meaning at the start, at the beginning, so on and so forth, right? So is it lying on the right side with legs straight, lying on the left side with the knees bent, prone with the torso elevated, or bent over with hands touching the floor? Not like Kevin Gates. Oh my God. But shout out to all y'all. Hey, I got these questions off nurseslabs.com. Hey, a little bit about me. Been a nurse for 3.5 years. I've worked ICU, I've worked OR, I've worked PACU. The PACU is the holy grail in my opinion. So, to each their own. Yeah, that's a little bit about me. We'll talk more about that. I want to know about you. I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what are you doing here hanging out with us? All right. And of course, the answer is B, lying on the left side with knees bent. For a colonoscopy, the nurse initially should position the client on the left side with the knees bent. That is part of reduction of risk potential, which is 9 to 15% on the NCLEX exam. It says I just failed one of my nursing exams. All right, Moon. So what are you going to do? You're going to sit here and pout and cry about it? Or are you going to turn around and tell me what you're going to do to fix it? You know what I'm saying? I don't say that to be rude. I say that to be realistic. I'm just saying. But shout out to everybody that just got that question right. All right, here we go. Question number 5. A male client with inflammatory bowel disease undergoes an ileostomy. On the first day after surgery, Nurse Oliver notes that the client's stoma appears dusky. All right, so there's some key words. After the first day and dusky, how should the nurse interpret the finding? So is it a blood supply to the stoma has been interrupted? This is a normal finding 1 day after surgery. The ostomy bag should be adjusted. Or an intestinal obstruction has occurred. What are we thinking? Shout out to all 622 of y'all out here rocking with me. We're doing NCLEX questions. We're on the road to 20,000 likes. I expect everyone to get carpal tunnel and stop playing games with me. All right. Get carpal tunnel. Stop playing games with me. All right. And got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. All right. I don't care if you think these questions are easy. Just shut up and answer them. Like what you mean, bro. All right, y'all. 10 more seconds. RN in Tennessee. Shout out to you. The crazy part is I studied every day. Okay. For real. For real. I know that's right. Got A. All right, Natalie. I take my NCLEX on the 14th. Shout out to you. What does dusky mean? I don't know. Some of those people I see down the street. No, let me stop. Let me stop. It says, this is fun. I learned a lot of questions per. There you go, Kayla. There you go. What's up? Is it Haza? NCLEX tomorrow. Lisa, you need to go. You need to go, Lisa. You need to go. I don't need you here. You need to be home. You need to be relaxing and not trying to sit up in here and trying to get your learn on. You know it all. You know it already. Not all of it, but you know it. You know what you need to know to pass. So shout out to you. But the answer is A. Blood supply to the stoma has been interrupted. An ileostomy stoma forms as the ileum is brought through the abdominal wall to the surface skin, creating an artificial opening for waste elimination. The stoma should appear cherry red, indicating adequate arterial perfusion. A dusky stoma suggests decreased perfusion, which may result from interruption of the stoma's blood supply and may lead to tissue damage or necrosis. That is part of reduction of risk potential, 9 to 15%. 9 to 15%, which is actually the 4th largest section on the NCLEX. 4th. Okay, do I do anything for what? For RNs or EMT basic? This is for RN, guy. What do we mean? What do we even mean out here? All right, hey, real quick, ladies and gentlemen, you're on the road to taking the NCLEX. I got some test taking tips to help you conquer it. Check it out. Free download, thebootnurse.com/test, or you guys can go check it out in the link up here. And you guys can go check that out for yourself. Hey, that's 42 pages of just absolute delicious, buttery goodness. You know what I'm saying? So go over there and get your learn on. It's helped people. I've been told it's good. Took some time. I enjoyed doing it. So you guys go over there and check that out for yourself. All right, here we go. Question number 16. Anthony suffers burns on the legs. Which nursing intervention helps prevent contractures? All right, is it apply knee splints, elevating the foot of the bed, hyperextending the patient's palms, or performing shoulder range of motion exercises? What are we thinking? What are we thinking? Shout out to all 600 of y'all out here rocking with me. We're doing NCLEX questions. I got these questions off nurseslabs.com. They are free sets of questions. You guys go over there and check them out for yourself. Make sure you guys keep smashing that like button. You guys share and you guys follow. That is the trifecta that gets in front of people's For You pages. So instead of y'all being greedy, coming here trying to get all this knowledge from me, share it to people. I know you're in cahoots with folks. You know what I'm saying? I know you in cahoots. Somebody said, Jordan said, I had to come back to this live and say I passed my NCLEX on the 31st. Shout out to you, sir. Jordan, my man. Shout out to Jordan. Hey, I need everybody right now to give Jordan all the love, all the support. Congratulations, Jordan. Jordan was a frequent flyer. Congratulations, sir, on passing your NCLEX. Welcome to the greatest shit show on earth known as being a nurse. If you have a piece of advice to give to everybody out here, what would it be? All right, here is our answer. Here's our answer in 3, 2. And the answer is apply knee splints. Applying knee splints prevents leg contractures by holding the joints in a position of function. That is physiological adaptation, which is 11 to 17%, making it the third largest section on the NCLEX. So shout out to all 840 of y'all that I know got it right. You know what I'm saying? That I know got it right. Appreciate everybody for the follows because there's so many of y'all I don't even know how I'm keeping up. So shout out to all of y'all. All right, here we go. Question number 7. Nurse Ron is assessing a client admitted with 2nd and 3rd degree burns of the face, arms, and chest. Paint the picture. How would you feel if you was at a bonfire on a beach during spring break, because most of y'all are some turds and that's what y'all are going to do, and you get burned on the face? What you think? What do you think is going to be a potential problem? Is it going to be a partial pressure of arterial oxygen, or PaO2, value of 80? Urine output of 20, white pulmonary secretion, or a rectal temp of 106. What are we thinking? What are we thinking? Shout out to all 800 plus of y'all. Hey, when we get to question 10, I'll give you guys another little tidbit about me. Because everybody was like, what does Kevin do? And I'm just like, bitch, I'm just here trying to help. Steph says, innovate now. Steph, shh, we ain't there yet. But yes, you are very much correct. You are very much correct. All right, 10 seconds, y'all. We got B's, we got D's. Viviana says C. Got you. All right, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is B. It's urine output of 20 mLs an hour. A urine output of less than 40 indicates burns, or a client with burns indicates a fluid volume deficit. All right, fluid volume. Some people are just like, what? Nash says less go. All right, that's part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. Naomi says, says RIP. You just letting folks die out here? What we doing? All right. Hey, so remember, you have management of care, pharmacological and parenteral therapies, physiological adaptation, and reduction of risk potential. They make up more than half of the NCLEX exam. All right, here we go. Question number 8. Mr. Mendoza, who has suffered a cerebral vascular accident, is too weak to move on his own. To help the client avoid pressure ulcers, Nurse Celia should what? Turn him frequently, perform passive range of motion exercises, reduce the client's fluid intake, or encourage the client to use a footboard. Hey, once again, don't care if you think that's easy. Just shut up and answer it. That's all out of love, though. But shout out to all 800 plus of y'all. We're doing NCLEX questions. Hey, if you guys are in nursing school right now and you have not shared this to anyone in your cahoots with, you're wrong. And I'm going to need for you to fix yourself. So fix yourself right now. And then I need for people to start dropping salutes in the chat. So y'all already know what the deal is. Drop salutes like, Kev, I got you. It says, we need more people like you, Kevin. You are such an inspiration. Look, this is what I do. This is what I love to do. I've been a teacher or an instructor and educator for the past 9 years. I love it. And our answer is A, turn him frequently and often. Somebody said every 2 hours. Yep. Sometimes doctors will say every hour, but every 2 hours is usually at the bare minimum, right? The most important intervention to prevent pressure ulcers is frequent position changing or changes, which relieve pressure on the skin and underlying tissues. If pressure isn't relieved, capillaries become occluded, reducing circulation and oxygenation of the tissues and resulting in cell death and ulcer formation. That is part of basic care and comfort, which is 6 to 12% on the NCLEX exam. You guys learn that in fundamentals or foundations or whatever we have going on, right? Now, what I will say is that it is a smaller section of the client needs. There's 8 client needs, and basic care and comfort is one of the smaller sections. All right. Not saying that you don't need to know it, but you need to know it. You know what I'm saying? Here we go. Question number 9. Nurse Maria plans to administer dexamethasone cream for a female client who has dermatitis over the anterior chest. How should the nurse apply this topical agent? All right, with a circular motion to enhance absorption, with an upward motion to increase blood supply to the affected area, and long, even outward and downward strokes in the direction of hair growth, or is it D, and long, even outward and upward strokes in the direction opposite hair growth? So what are we thinking? Shout out to all 700 plus of y'all. Hey, these are both for RNs and LPNs, nurseslabs.com. You guys can go over there and check them out for yourself. By the way, if you're in nursing school and you do nursing care plans, which you all do, Nurses labs, they have those too. They saved me when I was in nursing school, and they saved tons of other people when they were in nursing school. All right. So just saying, make sure you guys keep sharing, you guys like, you guys follow. All right. I'll give y'all 10 more seconds. Naj says it's B. All right. All right. Did anybody else come in here and say that they passed NCLEX? I'm sorry. I was reading, Oh, by the way, if you tell me that I talk too much, I don't care. Would you tell me that I talk too much if I was teaching you formally in front of a class? Then why the hell would you come here and tell me that? Don't be dumb. Disrespectfully, you know what I'm saying? Here we go. And the answer is C, in long, even outward and downward strokes in the direction of hair growth. When applying a topical agent, the nurse should begin at the midline and use long, even outward and downward strokes in the direction of hair growth. This application pattern reduces the risk of follicle irritation and skin inflammation. That's part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 14 to 18%. Another doctrine said 13 to 19. Regardless, it's still the second largest section and something that you need to pay attention to. Okay. It says your eyes like the male version of Nexus Nurse. I like it. Makes me remember the info. Oh, okay. I got you. Here we go. It says Justin ML. What is that? A medical? I forgot already. Yours. Oh, okay. I'm tracking. I got you. Here we go. Question number 10. Nurse Kate is aware that one of the following classes of medication protects the ischemic myocardium by blocking catecholamines and sympathetic nerve stimulation is what? Are they beta blockers, calcium channel blockers, narcotics, or nitrates? What are we thinking? Cassidy says A, medical lab student or scientist. I was going to say student. So shout out to you, med lab scientist. Think you're cool because you're a scientist? Think you're cool because you got the title of scientist at the end of your name? Oh my God, this guy. I'm just kidding, respectfully. Shout out to everybody here. We are doing NCLEX questions. Like I said, nurseslabs.com. They're free sets of questions. You guys can go over there and check them out for yourself. I need for you guys to like, share, follow, because that is a trifecta that I need to get into somebody's face respectfully. I'm just saying, thank you for this. I'm still in nursing school. This so much help. I'm glad this helped. We need you. Thank you. Hey, I need y'all, because if I don't have y'all, who am I teaching? My damn self? So it says, I recognize the lingo. I recognize the lingo. No, I was in the Navy, and that's actually what I was about to say. But I'll tell you all that in a second. But the answer is A, it's a beta blocker. Beta blockers work by blocking beta receptors in the myocardium, reducing the response at catecholamine and sympathetic nerve stimulation. They protect the myocardium, helping to reduce the risk of another infarction by decreasing myocardial oxygen demand. Once again, pharmacological, parenteral therapies, which is the second largest section on the NCLEX exam. Who is that? Denise? Denise, tell us right now. Tell us what happened. Tell us what happened right now, Denise. Denise, the floor is yours. I'm not going on to the next thing until you tell me. Mimi said, yes, with the claps. You passed what? I'm going to need for you to give me more context. You can't just say pass. What you passed? Gas? What you passed? Your exit on the highway? Like, what'd you do? Spell it out verbatim. Brianna said, wanted to say thank you for these. I found out I passed NCLEX yesterday. That's what I'm talking about. Shout out to Brianna. Brianna, you already know the deal. We want to know. What it says, I passed. Amanda, get out of here with that nonsense. I passed NCLEX 15 years ago. But shout out to you, though. But hey, everybody give Brianna all the love, all the support. Brianna, welcome to the greatest shit show on earth, known as being a nurse. If you have a piece of advice to give to everybody out here taking their exam, ma'am, what would it be?